All right, welcome everyone. Thank you for joining us today as we will be talking about identifying and dispelling homeopathic myths. It should be very exciting and fun. I am Dr. Elizabeth Rice. I am an associate professor and the department chair of homeopathy and pharmacology at Sonoran University of Health Sciences in Tempe, Arizona. And I have with me here Dr. Krommidas, who is my homeopathic fellow.
Hi, everyone. We're so excited to dive into this topic with all of you today. Yes, I'm a naturopathic doctor, and I love working alongside Dr. Rice doing my homeopathic fellowship at Sonoran University currently.
Yay. Okay, here we go. Here's our disclaimer. You should all read this in great detail, but I won't spend much more time than that. And we're just going to hop right in. So, Dr. Krommidas, can you take it away for us?
Absolutely. So, you may have heard that homeopathy is a very slow process, but homeopathy can stimulate a profound or dramatic change in someone's health after just one or two doses. This is especially true during acute infectious illnesses. Clinically, we hear from patients even just a couple days after they started their homeopathic medicine that we've prescribed for them for an acute illness. And they tell us that their symptoms have resolved or they're just about completely resolved. And this can sometimes even come back to us before we even get their throat or urine culture back, which can sometimes even avoid antibiotic use. And so it can be a very quick process for some patients with acute illnesses. The speedy recovery can also be true for chronic conditions, but it often takes time for the body to fully balance and heal. We would expect to see quicker results treating a child with eczema, for example, versus somebody with a 20 plus year history of neurological symptoms with multiple sclerosis. And so there is a difference between chronic and acute diseases, but overall, definitely not a slow process in the sense of especially acute diseases. So Samuel Hahnemann, the founder of homeopathy, said in his time that the most troublesome chronic diseases were those that had been complicated with drugs. Chronic cases can be treated with polypharmacy. Those are going to probably take longer since they're a little more complex. So the recovery might be a longer process. Another quote from Kent's lectures: remember that the acute diseases always tend to recovery, the chronic disease no tendency whatever to, but a continuous progressive tendency. They are far miasms. So again, with chronic diseases, we must be persistent with homeopathic treatment for longer periods of time because they are deeper and more complex in nature, and they might have multiple layers to heal from. This is why it's really important for people to work with a homeopathic provider who can manage their chronic diseases and tend to their more complicated case.
Absolutely.
And in 2022, we have a study here that looked at 300 patients with COVID-19. They were divided into two groups. They were treated with either just standard of care or in conjunction with homeopathy. And so the blue line here is going to be our group that was also given homeopathy. And in over 10 days, they showed earlier recovery and decrease in symptoms favoring the standard of care with homeopathy, which is really exciting. The recovery time was 2 days earlier for this group, and the resolution of fever was 20 hours earlier, showing the added benefits of homeopathy. And so this was a really great study, and we can see that it can be very useful conjunctively with standard of care.
See that all the time in my practice.
Mm-hmm.
Excellent study. Okay, myth number two. This myth, I'm going to take a few slides to talk about it because there's just so much to unfold here. But myth number two, homeopathic medicines are placebo. And I will say people who share this opinion that homeopathic medicines are just placebo are probably unaware of the current state of the scientific literature on homeopathic medicine. But first, let me define placebo. So placebo is the belief that the medicine is going to help, and it's the belief alone that triggers the healing response. So I ask you, if homeopathy really is just placebo, then how do you explain the fact that ultra dilutions exert biological effect in benchtop studies? Now we're talking in cell culture studies, plant studies, petri dishes. We see that these ultra high diluted medicines, the homeopathic medicines, have biological effects. And so what we have seen is that there's been homeopathic medicines that, for example, have homeopathic histamine, excuse me, when we add it to basophils, which is a white blood cell, it triggers them to release histamine. And these findings have been reported in several independent laboratories. And in fact, there have been 28 scientific papers published on this topic alone, and 23 of those reported positive results, which is incredibly exciting. We have here a systematic review of the homeopathic literature on in vitro studies only. There are 75 publications in the systematic review, which cover 67 laboratory experiments. And 1/3 of those lab experiments were replications, where they're repeating the exact same experiment previously. And what we saw is 3/4 of these experiments found that high potencies have an effect. And nearly 3/4 of the replications were positive. And this is incredibly exciting numbers. And I will say no petri dish that I've ever spoken with has reported a placebo effect. So it just doesn't even exist in this type of research. So that's really exciting. Let me move on to number 2. My second part of this myth. If homeopathy really is just placebo, how can we explain the fact that homeopathy can work in animals? Now, we need to be careful when we're defining what we mean by animals. If you're talking about pets, the placebo effect is real. So let's just say your beloved pet is sick and you're overwrought and just so unhappy that they're sick. And you give them a homeopathic medicine and you're confident in your prescription and you just know it's going to help, your anxiety is going to lessen and your pet is going to respond to that reduction in your anxiety and they're going to improve just based on that alone. So with this portion of talking about the myth, I'm not talking about our pets and our beloved pets. What I'm talking about is non-pet animals, so livestock, conventional farming practices. And what we see in the literature over and over is that homeopathy has an effect on these types of animals. So this arguably is my favorite study in all of the homeopathic literature. It's about the little piglets. This was a randomized controlled trial. So they used placebo and they used the homeopathic medicine on a commercial farm in the Netherlands. And what they did is they took 52 sows and gave them twice a week in their last month of pregnancy. So these were pregnant sows with the little piglets. They were given either placebo or they're given homeopathic E. coli. So this technically is an isopathy study. It's not exactly homeopathy because they're using the exact bug that is causing the disease in these little piglets, and they're using it to treat the little piglets. Let me back up a little bit. We're talking about treating diarrhea in these populations. And as we all know, in conventional farming practices, diarrhea is rampant amongst these animals, and there's often high use of antibiotics to try to control this. So that's what this study is attempting to look at, is using homeopathy as a replacement. So 52 sows were given either homeopathic E. coli or homeopathic placebo, and then their piglets were born. There was 525 piglets that were born from these sows, and we looked at their duration and the occurrence of their diarrhea. What we see is that the piglets in the homeopathically treated group had less severe diarrhea that lasts less longer, and there was less transmission amongst those treated with the homeopathic preparation. So I use this study in my classes all the time, and I question my students, if homeopathy is placebo, then how did these baby infant piglets know that their mothers were given a homeopathic medicine while they were still pregnant? So it's just not possible that placebo can exist in this type of study. Showed great positive results. Okay, my last piece of this, if homeopathy is really just placebo, how do you explain the existence of all of our positive, high-quality placebo-controlled trials? And when I'm talking about placebo-controlled trials, these types of study design are designed specifically to separate out the placebo effect from the real clinical effect of the treatment being tested. That's the whole reason this is our gold standard. And so we have the research team of Robert Matthey, who is the editor of the journal Homeopathy. They performed an analysis, and this was specifically on individualized treatment. So there's a lot of research out there on combo products or non-individualized homeopathy, and it's really specific that we're looking at the individualized treatment. That was how homeopathy was designed. That is how it works best. This is how Hahnemann intended it. And what Matthey's team saw was that homeopathic medicines, when prescribed individually, are 1.5 to 2 more times likely to have a beneficial effect than placebo. So we're seeing this in our randomized controlled trials in humans, that homeopathic medicines have a real effect and that they're not just placebo. So to highlight this, let me click to the next slide. Let's talk about how homeopathic medicines compare to conventional medicine. So by the end of 2022, there were 271 randomized controlled trials of homeopathy in about 144 medical conditions that had been published in peer-reviewed journals with enough information to be analyzed by Matthew and his team. So what we see when we look at these two graphs is that although the overall balance of the evidence is broadly similar between the two, what I want you to take a look at is the number of studies in each group. So if we look at chart A is the homeopathic group, there are 157 double-blind randomized controlled trials that are being analyzed here. And we see the fallout of the positive, negative, and inconclusive studies. And when we switch over to chart B for the systematic reviews of randomized controlled trials in conventional medicine, we have over 1,000 of them. And that's over 1,000 systematic reviews. And within the systematic reviews could be numbers of trials. And so we're seeing just there is so much more funding available for conventional medicine that allows them to do such robust studies. And what we see in the medical research budget of the United States, it was $51.1 billion and less than 0.5%, so about 0.4% was given to studying conventional and alternative medicines, or sorry, complementary and alternative medicines. And that's just so devastating, right? We just don't have the funding to do as robust trials as our conventional medicine counterparts. Now, when I show this to my students, they always love to point out, well, there's 10% in the conventional medicine that have negative studies and only 3% in homeopathy. But really, those two numbers are not statistically significant. There's not a great difference there. They're really basically the same thing. Like when we produce our studies, roughly the same amount of studies show positive results as conventional medicine, same amount show negative, and the majority showing like an inconclusive result. So I want to shout out special thanks to HRI. If you guys are interested in any type of looking into research, go to Homeopathic Research Institute's website, and they have such great information there for you.
Okay, and so to piggyback off on that myth, homeopathic medications are just water. So these medicines are made from plant, mineral, animal, and biological sources. The original material is diluted and then shaken vigorously, which is known as succussion. This process is repeated over and over until the desired strength or potency of the medicine has been reached. So we see this supported by experiments which show that unsuccussed dilutions are inactive, but succussed dilutions have biological effects, like Dr. Rice mentioned, suggesting that this aspect of the manufacturing process is essential in creating true homeopathic medicines that then stimulate the body to heal. And so these are not just water because of the studies that we're going to share with you right now. So in the 2023 study, these researchers investigated the impact of the succussion number on the effectiveness of ultra-high dilutions applied to arsenic-stressed wheat seeds. They found that increasing the succussion number significantly enhanced both the germination rate of the seeds and the fractal dimension of droplet evaporation patterns. And so what this all suggests, it sounds very sciencey, but ultra-high dilutions effects increase with higher succussion numbers, which highlights the importance of the succussion in the process of making these homeopathic medicines and making them true medicines instead of just placebo. So the controversial nature of homeopathy stems from some of these higher potencies like 30C, 200C. We know that these are extreme high dilutions that surpass Avogadro's number. So theoretically, we would think they leave no trace of the original substance. In this second study here, it revealed the presence of nanoparticles and aggregates from the starting materials that were tested. And so this groundbreaking discovery of these physical entities have now been perpetuating homeopathic research into looking at the mechanism of action and its therapeutic potential. So yes, we know that with the succussion and the dilution, these are very powerful medicines, although they're very gentle and very, very safe.
And not just water, are they?
Right.
Okay, myth number 4, homeopathy is a cure for all diseases. So as my students fall in love with homeopathy, they often think that it becomes this magical cure-all for everything. And I really don't love that I have to burst their bubble and say that homeopathy is not indicated for all conditions. And ultimately, we have to recognize that while homeopathy can stimulate such a profound and dramatic change in someone's health, just like Dr. Krommidas mentioned with like 1 or 2 doses in acute diseases, we also have to recognize that it's not effective everywhere. And so I break it down for my students into dynamic disease and non-dynamic disease. And so dynamic disease are diseases that result from an untuning of the vital force, as Hahnemann spoke about in the organon. However, there's a whole bunch of non-dynamic disease that Hahnemann is very clear that homeopathy is not a substitute for simply a healthy diet and lifestyle or living in damp cellars. He's very clear that there are things in which homeopathy is not going to be treatable with. So I like to reference my mentor, Stephen Messer. He developed this lecture, which this is a whole lecture in and of itself, but I'll spend just a little bit of time talking to you guys about the 7 conditions in which homeopathy is or is not effective. What we see in the literature, and particularly in the historic literature, is that homeopathy is incredibly effective in treating acute infectious diseases. I mean, if we go back in time to the day of Hahnemann, we're talking about epidemics of cholera, typhoid fever, the bubonic plague, things that would come through and decimate an entire village of people. And we see that homeopathy had such an astonishing low mortality rate in compared to the conventional treatments of that time, of course. But we see that homeopathy is incredibly effective in treating acute infectious disease, most recently within COVID-19. So if we move to the next one, in trauma, mechanical disease, genetic, and first aid, I'll give you one example of these 4, or a couple examples. Mechanical disease. So when I think of mechanical disease, I think of like a compound fracture where, like, let's just picture the bone is sticking out of the skin, right? That's such a lovely image, I know. There is no homeopathic pellet I could give a person that would allow the bone to like slide back in place and like fuse with the broken counterpart. That just doesn't, that's not real, right? So what we do see though is that once the bone is set, now the dynamic process of the bone rebuilding, restructuring, and regrowing together, that's where homeopathy can be effective. So that's a great example of mechanical disease. Genetic disease, we're talking about classic genetic diseases like trisomy 21 or cystic fibrosis. If an individual is born with one of those genetic diseases, there's no homeopathy that will change the course of their disease. Sorry, that came out wrong. Will change the fact that they have this disease. The child will always have Down syndrome, or the individual will always have cystic fibrosis. However, homeopathy can be palliative and can be very helpful at improving the quality of life for these individuals. And I have one patient that I started working with him when he was 22 months old, and he's now close to 13, and he has Down syndrome. And his mother used to share with me all of the things that conventional medicine said he will never do. He will never read, he will never jump, he will never swim. And she will send me videos of him swimming in his first swim meet, and he's reacted so beautifully to homeopathy. And I just love his case. So homeopathy can be helpful in those situations, but not curative, right? It's important to know. When I'm talking about organ failure, we're talking specifically about the organ death completely. We're not talking about heart failure or kidney failure where there's a slow progression and a gradation of degradation with those organs. So a great example would be like type 1 diabetes mellitus, where the islet cells of the pancreas have completely died and they're no longer producing insulin. There is no homeopathy that will stimulate those dead cells to start producing insulin again. It's just not possible. Disease of suggestion is what all young people are going through these days on social media, seeing that they're not tall enough or thin enough or beautiful enough or funny enough or great enough. These diseases of suggestion in the organon, Hahnemann is very clear that you need counter suggestion in order to be curative. Sure, it can be helpful with patients with anorexia to help deal with some of the trauma, but really these patients need counseling or therapy in order to reframe how they view the world and how they view themselves. And Hahnemann mentions that in the organon. Our diseases of lifestyle, excess stress, not even just emotional stress, but excess pollutants in our air and in our water and in our food, deficient substrate, like if you're lacking in vitamin C, if we travel back in time to our sailor ship days, and they had lack of vitamin C and their teeth would fall out due to scurvy. Again, no homeopathic medicine will keep their teeth in there unless they had vitamin C. So we have to be very clear that diseases, according to our lifestyle, are not going to be curative with homeopathy. Homeopathy may be palliative and may not do anything in those instances. And then if we talk about everything else in terms of chronic disease, what we see now in chronic disease, and as Dr. Krommidas mentioned, with polypharmacy and diseases being treated by drugs being the most difficult to treat, we see that chronic disease is a combination of all of these: excess stress, deficient nutrients, diseases of suggestion. And so those can be really challenging to treat depending on the complexity, but often the most gratifying when you help people come out of the fog over time by treating them homeopathically. So again, maybe for the next Homeo Summit, I will talk about all of these 7 conditions in detail. Okay, the next one is mine again. Homeopathy doesn't need any diagnosis. And this one may be controversial, as it is true that we can treat somebody homeopathically just based on their symptoms alone, and we don't actually need a diagnosis. However, medical diagnosis and the medical investigation are crucial for understanding and managing all of your patient's medical needs. And the diagnosis can often lead us to the right homeopathic medicine. And I have a great example. I had a woman in her 50s come to see me for significant constipation and even some urinary retention. And she said that all of her symptoms began with menopause. And as I dug a little deeper and I went through her review of systems and her past medical history and her family history, I discovered she was diagnosed with multiple sclerosis 18 years ago. And her symptoms had been relatively minor. She didn't do any of the treatments. And based on that information, I knew that her constipation and her urinary retention were likely due to her neurological diagnosis of multiple sclerosis and not due to starting menopause. And so rather than hunting around in our group of menopause remedies, I gave her a neurological remedy, Plumbum metallicum. And within a month, her constipation and urinary symptoms were much improved. She was very pleased. And I wonder if I had gone down the menopause route, that I might have gotten lost in the weeds and it might have taken me some time to find the right remedy for her. So in essence, while it may be true that we don't truly need that diagnosis, it can be incredibly helpful if we know exactly what it is that we are treating.
That's such a great example.
Thank you.
Homeopathic medicines cannot be taken with conventional medicines. So, this is not true. Homeopathic medicines do not interfere with conventional medicines. Much of the homeopathic literature uses homeopathy as an additive treatment to conventional therapies, and there are no drug interactions with conventional medicines, as the homeopathic dose is so infinitesimally small, and therefore homeopathy is just very safe to use alongside these treatments. To highlight this, we have a series of studies in the homeopathic literature that document it, and they show relief of adverse drug reactions, reported better quality of life, especially in cancer patients, which, if we can treat homeopathy with we could use homeopathy with chemotherapy, we can use it with any other drug. And so it's really amazing how safe and effective it can be in conjunction with other therapies. So in this 2022 retrospective cohort study, it evaluated the benefits of homeopathy on the quality of life of patients with non-metastatic breast cancer. And they saw that there is an increasing use of homeopathy in patients with breast cancer after diagnosis, leading to an overall decrease in medications that palliate the side effects of their cancer treatment. And in the next study right below that, they used classical homeopathy, and this showed improvement again in quality of life, as well as a tendency of their fatigue symptoms to decrease. And so overall, just general improvements when we're using this wonderful treatment option alongside chemotherapy. And we see it all the time. The side effects or even just quality of life really improve.
I did 18 months after my second year residency, working with oncology patients, and I worked alongside a naturopath, and we co-treated. I was doing homeopathy, she was doing naturopathy, and a lot of times her hands were tied because the supplements or her treatment plan would interfere with, perhaps the chemotherapy or definitely with the radiation. And we don't want to use any sort of antioxidants with our radiation treatment. And so I treated a lot of these patients using just homeopathy. And it was so helpful against this huge onslaught of like chemotherapeutic drugs. When I think of like the strongest drugs that we have out there, I think of chemotherapy, and our little white pellets were so helpful to these patients. Needless to say, oncology was a bit too much for me. It was just a heavy duty area to treat, and I much prefer general medicine.
Yeah, we'll
Okay.
see. we see
Mhm.
it all the time, right? We see us being able to even help patients come off of their medications very slowly since we're treating that root cause and using homeopathy along the way.
Love it. Okay, myth number 7, homeopathy is an alternative to surgery or antibiotics. So I recognize that this myth is incredibly controversial, particularly to this audience. But what I am going to say is that homeopathy can be used effectively as a complement to surgical procedures and antibiotics. And what we are seeing is physicians, at least all over the Phoenix Valley, which is where we are in Arizona, are prescribing arnica after their surgical procedures. I've had both my father-in-law recently had surgery and my sister recently had surgery, and both of them were prescribed homeopathic arnica. And I was just so tickled pink that the conventional doctors are starting to embrace this, even though there's so much other controversy and they say there's nothing in it. And they also say it's so dangerous. Like, get your story straight, people. However, they're reaching for it because it's effective. And we have about 30 studies where we see that homeopathic arnica has been used before and also after surgery and to increase speed, wound healing, stop bleeding, reduce swelling and pain. And I know that all of you guys have seen that with arnica because it's such a beautiful remedy, but now people are starting to recognize it conventionally. And then with regards to antibiotics, I know Dr. Krommidas had mentioned that, oftentimes we'll treat our patients and they're better before we get the culture results, which tell us what antibiotics to prescribe. I'll just leave it there. But here's a study where we see homeopathic eardrops added to the standard of care for children with acute otitis media. And what we see is that the homeopathic group had lower symptom severity, faster symptom improvement compared to those just using standard therapy alone. So here, yet again, we're seeing homeopathy is improving patients' health even while they're taking conventional medicines.
Yes, and absolutely. With arnica too, I just want to mention we can reduce opioid use as well. And, with using that in conjunction, it could be so helpful for even addiction reasons and things like that. All right, so next myth, we have homeopathic medicines contain heavy metals and steroids. So patients might think that there are steroids in these medicines because of how well they work and how quickly they work, right? But that's definitely not true. This is a myth. The Homeopathic Pharmacopoeia of the United States, which is also known as the HPUS, is the official reference for the identification and quality standards of homeopathic medicines. And they look at their starting materials, and they really look at their safety and make sure that they're safe for us to buy and consume. So the HPUS describes the manufacturing methods, the standards for compliance, focus on safety, quality, standardization. And there are over 1,300 officially monographed homeopathic drugs, all the way from starting from arnica to zincum alphabetically. And these medicines all have their own unique monograph. So a panel of experts are looking at these sources, they're looking at the quality control and the clinical use so that they're very safe for us to use. The HPUS is federally recognized. And although some of the medicines are derived from specific heavy metals, let's say like arsenicum album, right, or plumbum, like you mentioned, so these are going to not have the amount of original substance. So they are safe because they're highly diluted, highly succussed. And now we're able to have the body stimulate its amazing healing properties to do what it needs to heal. So yes, not harmful, and there are no heavy metals or steroids in these little pellets.
That's right. Like some of our herbs that we get from overseas can be contaminated with heavy metals, hopefully not any of the homeopathic products. Okay, myth number 9, self-medication in homeopathy is possible. So yes, people can treat themselves, especially if we're talking about acute or first aid conditions. You have a cough, it's deep, worse when it's hot. As soon as your head hits the pillow, you start coughing. Give yourself homeopathic Drosera, you're better, by the next day. Absolutely, in first aid and acute conditions, you can treat yourself. However, I'm hesitant to recommend people treating themselves for chronic diseases, particularly if there's a high complexity level to the case. So while might be able to find your similimum or that right remedy that you need right off the bat for your chronic case, most people start to feel better, and then there's often like a plateau or a regression of their chronic symptoms. It's like the body has this habit of falling back into old patterns. And when that happens, it's often requiring a change of potency or perhaps a change of the actual remedy during those times of plateau or relapse. And so that's not often easy for you to see or you to be able to do by yourself. So if you have a minor injury and some bruising, go ahead, take arnica, right? But if you have a complex medical condition, especially a chronic condition, I very much recommend having your condition, your case managed by a trained homeopath so that they can navigate those ups and downs over the course of treatment. And generally, what I see in my private practice, and this has been true in the homeopathic literature, is it's somewhere around 18 months to 2 years to really cure a patient of a chronic disease.
Right. And you might hear some homeopathic providers even say it's a 3 steps forward, 2 steps backward process, right? And
Mhm.
so we're taking these leaps and bounds, but then there's going to be some of that relapse sometimes. So you need that continued care with a trained homeopath. Okay, so myth number 10, the same white pills are given for all types of illnesses. So although all these medicines may look exactly alike, they're all these white, small little pills that come in these vials. These medicines are all very unique and they're derived from unique sources found in nature, like I mentioned earlier. So if 2 people are suffering from the same condition, that does not mean that they require the same homeopathic medicine. It very much depends on how they experience their symptoms because that is unique to them. And so that is called individualization. We always are looking, it's really great to have the diagnosis of a case so that we can look for the characteristic symptoms in that specific person's symptoms. And so we can pick that best medicine for them. These studies are prime examples. So in the top study, they used a really common remedy that's used for arthritis, Rhus tox, and all of these patients had osteoarthritis. In the bottom study, they did not use Rhus tox. They actually had homeopathic prescribers use classical homeopathy and pick one unique medicine that best fit each individual's symptoms. So in the bottom study, we are probably going to guess that they had positive results, and they did because they used that individualized care. Where in the top study, they used one standard homeopathic medicine for that condition, and they did not see positive results. So that is how important the individualization of this type of treatment is, right? We always want to be looking at the unique way that that person is experiencing their symptoms.
One of the things I love most about homeopathy, individualization. Okay, myth number 11. There are strict dietary restrictions in homeopathic treatment. And anyone who has been practicing homeopathy for long enough, you know that this myth exists. You might have even been practicing this early on in your practice. And with time, you've recognized that this is not true for everyone. So it all starts in the Organon, where Hahnemann said, coffee, tea, beers, fine liqueur, chocolate, perfumes, ice cream with coffee and vanilla, and any sort of medicinal substance. We should keep these from our patient, right? So that we don't interfere with their body's ability to respond to homeopathy. And although we haven't had any research to investigate this piece, this myth yet, clinically, what we see is that these food and substances are not necessarily interfering with everybody's ability to react to homeopathy. Sure, some people are highly sensitive, and if they drink a cup of coffee, it will interfere with their reaction to the homeopathic medicine. But this isn't true for everyone. And so it can often be a real source of frustration if the homeopath is like, you have to stop using your mint toothpaste. You can't drink your coffee in the morning, and you can't do this and you can't do that. It creates a great source of tension for the patient to be able to meet these standards, and then maybe frustration if the patient doesn't actually do it and reports, yeah, I drink my coffee. So what a lot of us have seen with practice is that it just doesn't happen. Most people can drink their coffee in the morning and they're still going to get better from homeopathy. They can keep using their mint toothpaste and their migraines still resolve with homeopathic treatment. So we have to keep in mind that everybody is an individual and the sensitivity varies from person to person. And so by a case basis, you might want to consider some of these things. But as a blanketed rule, not everybody needs to avoid all of these dietary restrictions for homeopathic treatment.
Absolutely. Okay, so homeopathic medicines are not for diabetic patients. So, homeopathic medicines contain a complex sugar known as lactose instead of glucose. So these medicines are not considered harmful for diabetic patients as far as the ingredients go, right? And so there are liquid forms that are also out there that are not sweet that can also be used if that's something that a diabetic patient prefers. This doesn't go to say even that homeopathy cannot be used for any type of diabetes, but we really want to be clear here that insulin injections are always going to be needed for type 1 diabetes, and homeopathy is not an alternative for insulin injections. And I really just want to make that very clear too. I had a parent, I remember, who had a little kiddo. She did so well on pulsatilla. All of her neurological symptoms and her mental emotional symptoms resolved on pulsatilla pretty quickly, like within a few months. And this was a chronic case. And so it really sticks out in my head. And I remember she had asked me at one of the appointments, if homeopathy can do all of this and really cure my daughter in such a way, can it cure her type 1 diabetes? And we had to have that conversation of the fact that there is that pertinent damage in the pancreas, right? And so that's not going to be reversible with homeopathy, and she'll need those insulin injections. And yes, so that was the one really important point I want to make here. But we have a study here that really shows that homeopathy can be used to actually help maintain normal blood sugar levels, and even in some cases slightly reduce blood sugar levels. And so in this study, they used homeopathy in all of these groups. Some of them also had allopathy as well, some other herbs alongside it or just alone. And in none of the cases was there increase in blood sugar levels. There were, of course, some outliers in all of the groups, but overall there was maintenance or reduction. So we can absolutely use it in conjunction with conventional medicine for diabetic patients.
I love how safe our medicine is. I think it's so amazing.
Yes.
Okay, guys, this is our last myth, and it's my favorite myth because this myth is perpetrated throughout homeopathy today, right now. And I'm here to bust this myth for you guys. The myth is homeopathic medicine should not be dosed daily. It will cause harm. It will cause engraftment. It will cause aggravation. And I will say that this is, again, not true for the majority of people, particularly with how sick our patient population is today. Patients can easily be dosed daily with medicines, even of a 1M potency. Now, keep in mind, I know it's 1M potency daily. I recognize that this is not true for everyone. And I even just had a conversation yesterday with a patient. The patient was dosing a homeopathic Natrum muriaticum 1M daily and was starting to experience all sorts of like overstimulation, anxiety-like symptoms, and they had been worsening in the last couple of weeks. And in that instance, I felt for that individual, that was too much frequent dosing of the medicine. The patient had improved so dramatically with the previous potencies of Natrum Mur that at this point, I think we were overstimulating the vis, and it was just a little bit too much. So in a lot of instances, you need to pay attention and make sure that you're not necessarily causing proving symptoms or overstimulating the patient. However, this isn't true for everybody. So like a 30C dose daily is incredibly safe and incredibly effective. And so the reason that I know this is how I practice. And the reason that I practice this way is that's how my mentor, Stephen Messer, practiced. And Stephen Messer came across the work of the elder Francisco Aziaga in Buenos Aires. And it was Aziaga who was suggesting that regular redosing helps patients automatically start responding when they relapse, right? So we talk about that relapse. And what we see when we have like a daily dosing schedule is like if the relapse happens, that next dose is usually right there and available for them to respond in about 24-hour period or however frequently. And Asiago was dosing like a 6Cs, 9Cs, 12Cs, up to 4 times a day in his patients. And what I inherited from Stephen Messer is we often are dosing like a 30C once a day, which is a very standard approach, 200C once a day, 1M once a day. It's right around the 1M potency that I'm starting to keep the lookout for patients who are going to have a stronger response to that. But some patients tolerate it beautifully. 10Ms regularly, I know, on a daily dose. Our hypersensitive population, which is roughly about 2% of the population, they may not tolerate this daily dosing. But when I talk to my students about this, because this is how we're taught it at our school, and I know that it is incredibly controversial as we get out into the great wide world of homeopathy, it kind of is like that elevator button, when we push the elevator button and it lights up, often we know that the elevator's on its way. But if you are particularly impatient and you're in a hurry, what are you going to do? You're going to push that elevator button repeatedly. And that doesn't make the elevator come any faster. It doesn't do any damage to the elevator. And we see that with most of our patients with daily dosing is they'll react to that first dose, as Asiaga said, and then usually will be immune to all the subsequent doses until they need that dose again. And it's just a really beautiful way to dose your patients, to dose yourself, to dose your family. If you have any questions about this, because I know this is relatively new, and again, the research hasn't been focused on posology so much lately, our science of dosing, but it's a topic that I'm really interested in. And I think nowadays with like our COVID-19 and our long COVID patients and our lack of sufficient diets and healthy diets and so much screen time and so much stress, our patients are so much sicker in a different way than they were in Hahnemann's time. And I think more frequent dosing can be really beneficial for our patients. So that's my last one. Oh, so we have all of our references here for you guys if you wanted to look at any of the studies that we talked about. And ultimately, we just want to thank you for your time. Thank you for listening to us. We hope that we were able to bust some myths that you may have about homeopathy in your own mind. And we are completely available to you if you want to continue this discussion or have any questions. Here's our email. It's been a real pleasure to speak with you guys today. Thank you so much.
Thank you.